Hi, I'm Dr. Mime.
Hi, my name is Brooke. I got abdominal liposuction on November 14th of 2019. It's already been 6 months since the procedure, and these are my before and after photos.
There is quite a difference. This is the exact photo of the fat we extracted. Brooke got 600 cc's from the back and 1,100 cc's from both the abdomen and the waist.
After the surgery, they showed me photographs and told me the exact amount of extracted fat. So I was very reassured about the results because I could see it for myself.
Let's check the in-body analysis, measured before the surgery. Height, 170 centimeters, and weight, 67.3 kgs. The orange area indicates the optimal range. However, both the BMI and percent body fat were over recommended criteria. There was a thick layer of visceral fat and the body was considered obese. The red and the black indicate the amount of fat and muscle respective in each body part. Overall, there was a moderate amount of muscle, but a relatively high amount of fat.
Here's the in-body analysis measured this morning. Let's see how it's changed over the last 6 months. As you can see, both the BMI and PBF have been significantly reduced, and now they are in the optimal range. The visceral fat level has gone down from 8 to 5, and my body type is now considered standard. I'm pretty happy that I'm maintaining my results after liposuction.
That's a huge improvement. What made you consider liposuction?
My motivation to get this surgery was to address the muffin top shape of my body. It wasn't really about losing weight since I've done that many times in my life. However, no matter how much weight I've lost, I've never been able to resolve my fat distribution problem. Even at my thinnest, I still hated the way there was always this tiny bit of fat that settled in as love handles, like right above my hips. And my hips are very narrow, so it gave it that unflattering muffin top look. So I thought this surgery would help me with that issue and give me a more appealing shape.
What were the changes that came with your new body?
Most of the clothes that I was wearing prior to the surgery are now too big for me to wear, so that's really exciting. I've gone down 2 sizes so far. I've also noticed that clothes fit me differently now due to the surgery. It addressed that unflattering fat distribution problem that I had, so not only are clothes fitting me more closely and tightly, but the shape is very nice. It's what I wanted. So I no longer have that muffin top that I really hated, yes. And that's a huge relief.
Wow. Well, today we'll talk about the precautions following liposuction surgery with Brooke. Do not lay on your side or on your stomach for about 2 weeks post-surgery. Try to sleep face up. Brooke, did you experience any discomfort while you were sleeping post-surgery?
Yes, since I normally sleep in different positions throughout the night, it was a little difficult to lose my mobility after the surgery. So the pain was too intense to move very much, sitting up and laying down. So it was harder to fall asleep, but this only lasted for a few days before I was able to sleep fairly comfortably again.
There are no restrictions to food post-surgery. Get adequate exercise and eat a low-calorie diet to maintain the outcome of the surgery. Bruising and swelling will intensify 2 to 3 days post-surgery. It will start to get better during a period of 2 to 4 weeks after that. You may experience temporary stomach distension because swelling starts from the upper part of the body and goes downwards. You will feel more satisfied with the results after a month, and any remaining swelling disappears slowly within 2 to 3 months after that. A corrective garment is worn for a month after liposuction to attach the gap that forms between the fat and the muscle layers. After the fat is gone, it is okay to remove it temporarily when you take a shower or wash the garment. However, we recommend wearing it on all other occasions. The operated area can become lumpy if the corrective garment is wrinkly or uneven. It is very important to make sure it is tight and wrinkle-free. Brooke, did you feel any discomfort while you were wearing the garment?
Yeah, the corrective garment took some time to get used to, but it actually became more of a comfort after a while because it made the area feel more secure. In the beginning, it made sitting and laying down pretty painful because it was pressing against the sore spots. But it definitely got easier to deal with as time went on. Like I said, by the end I was kind of attached to it. I didn't want to take it off because it made me feel like everything was where it should be.
Very good. So it definitely helped.
Yeah,
right?
It did.
Yeah, so that's another good point. Make sure to tailor the garment once it becomes loose as the swelling goes down so that it can fit you. If you are in Korea, free tailoring is available at the hospital. If you are not in Korea, I would recommend looking for someone to tailor it. You can take showers the day after removing stitches. They are usually removed 7 to 10 days following the surgery. It is best to refrain from taking a shower before removing the stitches. If you really have to, you can take a shower 3 days post-operation with waterproof bandages on top of the stitches. It is important to be careful and prevent infections. Brooke, how was your experience?
It was inconvenient to not be able to shower, but since I was at home not doing anything at all, I was just with my cat watching TV, it wasn't that bad for me. I did use a lot of dry shampoo, which is very helpful for these situations.
Light walking 2 to 3 days post-surgery helps patients recover faster. Light exercise is possible 2 to 3 weeks post-operation, and 1 month for more strenuous exercise. Brooke, I heard you were able to incorporate some exercises post-operation. Could you share your experience?
Sure. Actually, this surgery really inspired me to change my lifestyle and the way I treat my body so that I can maintain my results in the future. For exercise, I don't have a car, so I pretty much walk everywhere, and that really helps with weight loss. I also love to dance and swim laps, so that's what I've been doing to maintain my results.
Brooke, what were you prescribed after your surgery?
I was prescribed antibiotics, painkillers, and medication that protects the liver post-operation. I had the first round 30 minutes after my first meal post-op, and it's important to take it at the right time as instructed.
Aspirin and vitamin E can cause bleeding. Do not take them for a week post-surgery. Because of the consumption of alcohol and smoking may cause bleeding, damage to wound recovery, and infection, it is important to abstain from both for 1 month following surgery.
Right, and plus drinking is one of the main culprits behind weight gain. Alcohol has a lot of calories, so drinking less is definitely better for your health.
You will visit the clinic the day after surgery. Then on the 4th and 7th day, this can vary depending on each patient's recovery.
Tightness or numbness of the skin is a normal part of recovery. It's the worst during the first and second months, but improves gradually over time.
The operated area can temporarily feel hard and lumpy, but it improves over time. Sometimes the tissue fluid does not get absorbed and collected in the operated area if a lot of fat has been removed. This can heal by getting treatment at the clinic.
So I think a lot of people might have some questions about the surgery, so let's ask Dr. Mine. There is a lot of bruising post-surgery. How long will it take for it to heal?
It takes about 2 weeks. We give smart lux and high-frequency treatment to aid you in your recovery.
Next question. What if there's bleeding in the operated area? Is this normal?
Yes, very normal. You may experience some bleeding at home the day of the surgery. This is normal, so there's no need to worry. It's the lipolysis solution mixed with blood, and you might see it for 2 to 3 days.
What about if the incision looks red after liposuction? What would you recommend?
Yes, this is very common. The incision becomes red for up to 3 months and starts fading at the 6 months post-operation. Purchase scar ointments such as Derma Ultra or Contract Tubex from the pharmacy. Apply a very thin layer once a day before going to bed. Make sure to apply it for up to 6 months to 1 year.
Now I have a feeling a lot of people will be interested in this question. Can any desired amount of fat be removed?
Unfortunately, no. The most fat that could be removed has to be within safe boundaries. Removing too much can result in necrosis due to extreme thinning of the fat layer. We remove the most amount in the safest possible way after a consultation.
Now, how long does the pain last? When can I go back to my daily routine?
Usually the pain lasts for 2 weeks post-surgery and starts improving gradually.
In my case, during the first 3 days, the pain was an 8 out of 10. But after the 7th day, there was no problem with my daily routine.
Well, thank you very much for coming today, Brooke.
Of course, it was enjoyable for me as well.
Good. I really hope you found this video helpful. Please subscribe, like, and share our video.
Until we meet again, beauty is mine. Bye-bye.